Okay, so we're ready to do trach care. Miss Smith has got a tracheostomy and we've already done our suctioning, so now we need to do trach care. Usually trach care is done maybe every 12 hours, sometimes every 8 hours, depending on the patient and the condition of their tracheostomy. So we're going to go in and do our trach care. So, knock, knock. Hey, Miss Smith, my name is Shelley. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay. Well, it's time to do our trach care. I'm going to do privacy. Do you have any questions? I know you've had it done many times before. No? Okay. I'll get my equipment ready. Now, anytime a patient has got a trach, you will have this at the bedside. It's called an obturator. And this is in case the patient coughs the trach out, that this slides back into the opening and serves as a guide if you have to put it back in. So if you have a trach, patient always look for this somewhere at the bedside. It's usually taped to the wall or it's in the drawer at the bedside. But again, it's an obturator. If your patient, and our patient here has got called a non-disposable trach. I'm going to let you zoom in up here on it. You will see that it's got a locked place. It's a size 4. And it's got lock and unlocked. Let's see, it's a size 4. And that's key. You got to be sure that it's in the locked position. If it's not, the patient could cough it out. It's also got, and you don't have to have this for them to breathe. They can still breathe through this. This helps if it gets occluded or clogged. And this is the part we're going to be cleaning. It's in the locked position. We're going to put the fenestrated gauze around it, and we're going to tie the strings as well. Okay. Now, some patients, like these cannot be thrown away. These come with it. Some patients, and that's called the inner cannula. This is the inner cannula, and this is the faceplate. So this is your inner cannula. This one is not disposable. Some patients now have got a disposable one, which looks like this. And you've got these in your kits. So if you want to make you a trach setup at home to practice, I advise you to do that. So this is a disposable trach, where these will fit. This one will not fit this one because it's a different size. Instead of having this one that is not disposable that we have to clean, these would fit in, and then 2 or 3 times a day, the nurse would just take these out, throw them away, clean around the faceplate, and put a new one of these in. But to do trach care, we're going to clean that one. Okay. So if they're disposable, you just throw this away and you don't have to clean these. Okay. So to do our trach care, I've identified my patient. I provided for privacy. I'm going to pick the bed up at a workable height for me. Again, she's got her oxygen on, so we do not want to deprive her from oxygen during this. I'm going to lay her a little flatter because, again, when you take that cannula out, you don't want to contaminate it by hitting her breastbone. And I'm going to put my side rail down so that I can work. Okay. Now our solutions that we're going to use, and you really have to use the solution that's based on what your facility says to use. It's usually always 0.9 normal saline, sterile. Some places want you to use peroxide, half-strength peroxide. Some places don't want you to use peroxide. Some kits will come with saline and peroxide, some won't. Ours do not come with it, so that's why I brought extra. And these are have been open in less than 24 hours, so we can still use them. And this is our trach care kit. This is what you've got in your package. So again, I'm gonna go ahead and open these because I'm a bit of a klutz, and I'm gonna go ahead and open these. I'm gonna open away from me. Again, I'm standing close to my patient so I can just turn. Again, I can only touch the edge of this. I cannot reach down in it yet. I'm not sterile. So So if I'm going to move it, I have to move it to the outside. Okay, so how it's packaged is my sterile gloves are on top. So I'm going to reach in and get my sterile gloves. And I'm going to put my garbage can over here where I can reach it better. These do come labeled left and right. Now nothing can go over that because I cannot contaminate the inside of it. Okay, I'm going to pick up my first one, like we've done before, to the inside. Find my thumb. The second one, I'm going to put my 4 fingers in. Okay, now if I want to get rid of this paper, I have to touch it to the inside and land it right on the garbage can. I'm that good. Now I have to set up my sterile field. So I'm going to take, again, one of these lovely pads. And then I've got on sterile gloves so I can touch all of this. Again, it's got a shiny side and a dull side. The shiny side goes down. If I want to move it, I have to touch it to the inside. I cannot touch the corners. Now I'm going to empty my tray off onto this. And I can't touch the outside of that. I've got my fenestrated gauze, which has got the split in it. And I cannot get within 1 inch of that border. I've got my gauze, right there. I've got my 2 4x4s. I've got my tie. Got my scrubby brush. I've got 2 pipe cleaners. And I've got several Q-tips. Now, if you look in here, there's 3 containers. There's a washing one, a rinse one, and then you've got a extra one that we're going to clean around our insertion side of our trach. I don't like how that's setting, so I'm going to twist it. I'm not going to reach over my sterile field because I want the one I'm going to clean in to be closest to me. So now I have to contaminate one of my hands. So I'm going to contaminate my non-dominant hand and I'm going to pour my solutions, okay? So again, I can't reach over that sterile field. So I'm going to come around. This one is sterile. I'm going to lip it. Got to keep my hands up because I don't want to drop below my waist. And I'm going to pour normal saline in all 3 of my containers. And I'm going to come around, set this there. Now I need some peroxide in the one that I'm going to clean in. So I'm going to lip and I'm going to pour a 1/2 strength peroxide into that one. Okay, this hand is still sterile, this one is dirty. So now I have to get the inner cannula out. So I'm going to move this and I'm going to take this out. The only part I can touch is this white part. I cannot touch the inside. So you got to watch how it pulls out, that that doesn't hit. And I'm going to put their oxygen back over, okay? So I've got it out. I'm going to hold onto it and I'm going to put it into my 50-50 solution. And with my sterile hand, I'm going to get my little scrubby brush and I'm going to scrub, scrub, scrub. I'm going to scrub, scrub, scrub. You can go down in it, back up so it won't get on my phone. And kind of pull out, scrub, scrub, scrub. You can leave that in there. If you need to and you can't get all the gunkies out, you can use one of the pipe cleaners and go up in and scrub, 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 scrub. I'm going to drop that in the garbage. Now I'm going to rinse it. So I'm going to put it over in my rinse tub. And I'm going to rinse that off because you want to get the peroxide off. And you can tap, tap, tap. And I always like to tap and get the excess moisture off with that 4x4. That's really the end of the sterile process. So now I'm going to, I can move this out of the way, and I've got to get this back in without touching it on anything. And it locks into place. There you go. Okay, so we've cleaned the inner cannula. Now we've got to clean around the faceplate and change that soil dressing. So even though this is not strictly sterile, we're going to do it as clean as possible and not make a big mess. So we're going to get out this gauze from back and behind this faceplate carefully. We're going to look at this gauze to see if there's any drainage, any bleeding, any signs of infection, any type of purulent drainage, and we're going to throw it away. Now we're going to take our Q-tips. I just pick them all up usually. I'm going to wet them in that third container. It's just saline. And I'm going to carefully clean around that insertion site with one swipe. You don't want to go back and forth, back and forth. You want to make clean swipes. I'm going to get up and under it. And you have to get right up to where that insertion site is, under this faceplate. And of course, on a real person, it looks completely different. And get around it. With this other 4x4, I like to put it in a little bit of that saline and clean around this faceplate, because sometimes it can get gunky. You can even take it and clean this out, because these can get really mucousy. So clean it out. Okay, now we have to put our new gauze under it and change our ties. Now in the hospital settings, they've got these nice Velcro ones. We don't have that. We're going to do these lovely shoestring-like things. So they're usually tied on both sides. You never want to untie both sides at once. So I'm going to untie one side. Always keep a hold on it. If I let go and they cough big, it's going to pop out onto their chest, because that shoestring is all that's holding it in place. This is an uncuffed trach. There are some trachs that are called cuffed, and it's like a Foley catheter. It's got a balloon at the end that's inflated that holds it in place in the airway. But this one is uncuffed, so you cannot let go of it. I'm going to go ahead and take my gauze, and while I've got that one side let up, I'm going to go ahead and put this new fenestrated gauze up under that faceplate. You always want to use a gauze that is fenestrated, that's been cut by the manufacturer. You don't want to take a 4x4 and cut it with scissors yourself, because it gets those little stringies that can get embedded down into that raw trach site and be uncomfortable for that patient. So I'm still holding on. I'm going to take my string and I'm going to tie a slip knot. So you've got to tie a slip knot in this. It cannot be tied in a knot. It's got to be tied so that if something's wrong, you can just pull one string and it comes loose. To move this one over, this one here. And sometimes these shoestrings can be very gooky as well. So I'm going to tie this one again with a slip knot, The slip knots take practice, so beware. That seems to be what people struggle the most with. You want it to be tight, but not too tight, because again, that's what's holding it in. I think it's caught on the back of my mannequin. Okay, so I'm going to pull it, and I'm going to do a slip knot. There we go. Put our oxygen back over the patient. Put that in place. How are you doing, Miss Smith? That looks really good. Okay. Now I'm going to clean up my area. Take this off. I'm going to raise my side rails. I'm going to raise her bed up. I'm going to lower it to the lowest position. I'm going to put my caps back on my liquids because they're still good. And clean up my area and document how the patient tolerated it and what her trach insertion site looked like. And that's trach care.